conditions, consistently undermined healthcare exchanges where Americans can sign up for the plans they want. From 2016 to 2020, enrollment stayed flat. In contrast, over 8 million Americans have gained coverage since President Biden took office. In 2022, the uninsured rate dropped to an historic low of just under 8%. And in the open enrollment period that ended just a few weeks ago, over 21 million Americans signed up for health care coverage through the Affordable Care Act's marketplace, and this is an all-time record. As we've expanded coverage, we've saved families hundreds of dollars, and let me just explain how we did this. First, we started with premiums. The American Rescue Plan lowered costs for health care by expanding tax credits. Families save an average of $40 per person per month on premiums, and 1/3 of customers find coverage for $10 or less per month. The Inflation Reduction Act extended the American Rescue Plan's low premiums. Nearly 15 million people are saving an average of $800 per year. Second, because the drug companies shouldn't be able to unfairly profit off hardworking Americans, the IRA helps level the playing field by allowing Medicare to negotiate prices for key prescription drugs. This is projected to reduce the deficit by over $95 billion. The IRA also requires drug companies to pay rebates to Medicare if they raise prices faster than inflation, because there's no justification for this same drug becoming more expensive over time. In 2023, these rebates saved some seniors on Medicare using these drugs as much as $600 per dose. Third, the IRA lowers the cost of common health treatments. It caps the cost of insulin at $35 a month for Medicare beneficiaries. For many with Medicare, it also makes important vaccines available with no out-of-pocket costs, and it caps out-of-pocket spending on prescription drugs. This prescription drug cap is projected to lead to annual savings of $400 per person. Beyond the American Rescue Plan and the Inflation Reduction Act, we're also taking action to fight against unfair and surprise bills that hurt everyday Americans. We're working to give Americans more predictability and control, from protecting consumers from unfair medical debt to cracking down on misleading insurance products that result in medical bills of thousands of dollars. Well, there are other actions the President and I would like to take to bring healthcare costs down even more. That includes making the low premiums we've put in place permanent. We also need to make sure Americans access the support that's available. For example, we're doing all we can so that everyone eligible for Medicaid or CHIP coverage knows that they must take action to renew their coverage, because states restarted their annual Medicaid and CHIP reviews last year. And I encourage anyone here who's eligible to complete their renewal if they haven't yet done so. We're also progressing full steam ahead on other priorities, such as increasing transparency in healthcare plans so that Americans aren't stuck in plans that don't meet their needs. Across all our work, we remain focused on fairness, working to narrow gaps in coverage and in care. The work we've done and have ahead on healthcare is crucial, and it's motivated by the same values that motivate much of our economic agenda. By making healthcare more accessible and affordable, We're helping middle-class Americans live healthier, more financially secure lives. These Americans are at the heart of our economy, and they'll continue to drive our country's success. So thank you all for allowing me to visit this impressive healthcare center and for joining me today. Thank you.